Mini-Symposium session, Menopause and Age-Related Issues. I am truly grateful for your participation. Now I would like to invite Professor Anuji Gamage, our session moderator, to the panel. Professor Anuji Gamage is a professor of public health at General Sir John Kothawala Defence University and a visiting lecturer at the Postgraduate Institute of Medicine at the University of Colombo, with a strong background as a community medicine specialist and primary care physician. Professor Anuji Gamage, the session is over to you.
Thank you, Damayanti. Okay, so today I welcome you all to this session on menopause and aging. Let me invite Dr. Darshana Abegunawardana and Dr. Shiromali Disanayaka and Ms. Edna Mokaya to the stage. And let me introduce Dr. Darshana Abegunawardana. Dr. Darshana Abegunawardana is a prominent obstetrician and gynecologist serving as an honorary senior lecturer at the University of Sri Jawadanapura, Secretary of the Menopause Society of Sri Lanka. He is involved with the South Asian Federation of Obstetricians and Gynecologists and the Sexual and Reproductive Health Committee of the Asia and Oceania Federation of Obstetrics and Gynecology. Dr. Shiromali Disanayaka is a committed community medicine professional specializing in maternal and child health. She serves as the Social Secretary of the Menopause Society of Sri Lanka. She is a member of the National Resource Pool for Gender-Based Violence and acts as a resource person for the National Elderly Childcare Development Program and Adolescent Health. Dr. Disanayaka also contributes to the National Non-Communicable Disease Program. Ms. Edna Mokaya is an experienced professional specializing in sexual and reproductive health. She holds a Master's of Public Health in SRH, a bachelor's degree in Food, Nutrition and Diabetes. Currently serving as the SRH Technical Advisor at the International Planned Parenthood Federation Humanitarian Division. Edna has extensive experience in the humanitarian sector focusing on SRH and emergencies. What are the common menopause-related issues among Sri Lankan women?
We need to know the woman, who is the woman we are referring to. The woman at midlife. Now she is passing through a very transitional phase in her life. So when we go through the statistics, and the female workforce is somewhere around 32%. Their dedication and to unpaid domestic and the care work, actually we didn't calculate this one to that figure. So even the older women, they remain very active. When they come to this age, many women are in very key positions in the hierarchy and they contribute still. Then this is very vital. Their decision making and their service management is very vital for the development of the country. So unfortunately, we have very limited number of research in this field. In Sri Lankan context. Cross-sectional study was done in Sri Lanka, and there it shows the prevalence. More than 90% had one or few menopausal symptoms. The most prevalent menopausal symptoms was the joint and muscle discomfort. Physical and mental exhaustion was seen in somewhere around 55%, but actually hot flushes were seen only in 40%. I don't know, difference maybe because we are in a country in the equatorial region, so then we are very used to this hot weather, and the woman will perceive this as a normal thing in their life. We as a Menopause Society, we had a recent study to understand the health issues in this population. During this study, we realized 65% of women had one or more non-communicable diseases. Dyslipidemia was found in 71% of the population. About 68 to 69% had hypertension and the diabetes in 30%. Major osteoporosis risk and the hip fracture risk somewhere around 26%. Metabolic syndrome risk was 65% again. So there will be a very big impact. To address these issues, there are so many barriers and the restrictions in Sri Lankan context. They are not aware of these menopausal symptoms. or maybe negative attitude, or even socio-behavioral problems, restrictions, or stigma behind these. When we compare a woman in a European country and Sri Lanka, it's totally different. If they perceive a menopause as symptoms, they will quickly go to a doctor. But unfortunately, in developed and developing countries, they don't want to perceive. If they go, they can prevent most of the preventable complications. And the other thing is a social stigma, and the other thing is the negative attitudes. Sometimes they don't want to go for medical advice due to economic crisis. Government is not in a position to provide hormones, very freely. The other thing is the access to healthcare facilities, and the other thing is we don't have support groups. But unfortunately, we are not in a position to have such groups. I think these are the problems related to menopause in our country.
Thank you, Dr. Gunawardena. You're very insightful, actually. Moving to Dr. Disanayaka. So, we would like to know what are the social impact and societal response to menopause and age-related issues.
Thank you. Actually, the menopause is a biological phenomenon which all the female are facing in one day. We have to address on this. We have to manage properly. If not, there will be a big problems coming. In Sri Lanka, the knowledge dissemination is very less. There is no grassroots level proper program is going on. Mostly doesn't know anything about menopause. So if she knows all these things, she is prepared for this, and then she is ready for the menopause, and that will be the very happy life of her. As Darshana said, aches and pains are the main problem in our country, but no one knows that is due to menopause. So, but behind this is menopause. So another one is the hot flushes, I'd say the third cause. She's embarrassing and she can't work properly as earlier. For example, very cool night. She's going to switch on the fan and the AC, and the partner have to tolerate these things. So without understanding this issue, there'll be a big problem with the time. The wife is a key role at home. She can't work at workplace also efficiently like other days. So finally the outcome is very bad. So this is a vicious cycle going on and again and again. At the moment, 60% of the females are in this age group, 40 to 60 years. If you are not identifying these issues, health seeking is very high, and the health expenditures also getting higher and higher. So we can identify these things very early. If we can do some intervention in the early stage of menopause, there will be a big outcome as well.
Okay, Dr. Disanayaka, thank you very much. Ms. Mukaya, so she will be talking on the psychosocial impact of menopause on women.
Yeah, thank you. I'm looking at how this woman is interacting with herself and also how she's interacting with the environment. This is a woman who was surprised, first of all, with her menses as an adolescent. And she's settled, she's thinking, now I'm going to have fun. And then she's caught up with another surprise. This body you had thought that you had controlled, you can no longer control it. I don't understand what is happening to my body. Life has changed. First, I am not aware on what it is that is happening to my body. I isolate myself. I am the conqueror. And now I cannot even manage my own body. And now examining myself and thinking, what did I do wrong? You don't have the patience as a woman. The ones who notice will call you and ask what is the problem. I can't even remember what I was told. And I can't even find, just a simple thing like unlocking the door because I have a password. I have a thought block. I am frustrated and wondering what is happening. That affects my performance at work. Nobody understands. We don't also even understand. We get frustrated. Now, you are asked a question, then your own brain shames you and decides, no, this one we are not answering. You are expected to be there, but you can't. Affects your performance, might affect your pay or being retained in work. Menopause, most of the women are managing their old parents. So in Africa, we call it the African tax. You don't know how to be supportive, you become irritable. If you are in a society that doesn't really have the patience, such women are condemned and put in facilities. Most women, studies have shown that they go to health facilities to try to find answers. We have psychosomatic issues. You're imagining sickness because the health system also is not well prepared. In summary, menopause affects women a lot because we know of the estrogen drop, and that's why we find this affecting us physically, physiologically, and then it affects our social life and everyone around us. Thank you.
Thank you. Thank you so much. So, what initiatives have the government, Sri Lankan government, taken to mitigate menopause-related issues? Do we have such things?
Very less to talk on. I think government is trying, but anyway, they don't know what to do. We suggested menopause task force. So what our intention was to, make a team spirit. It was initially agreed upon, but anyways, unfortunately, it was not implemented. We wanted to start dedicated midlife clinic. Actually, we made even the health record is also finalized. So all in all, but we couldn't still start yet. But we did some programs, and then we conducted one clinic at Castle. What I can say, only clinic which I know is the Well Woman Clinic. Unfortunately, the target group is 35 to 45. So we really suggested to increase it to 60. But anyway, then still not implemented. I think they wanted to include menopause rating scale into these health records. But I think it's a good initiative at least. There are some programs run by Menopause Society. We are in that ground, so we know awareness is the main problem. We have to make aware of this public. So we do conduct courses for the pub separately. We do conduct courses for the health staff separately. There's a very good feedback. We can, on an open discussion about this topic, can change the stigma behind this topic. Other than those things, there's no any initiation by the government. Yeah.
Do we have, how have the government addressed age-related issues at society level in Sri Lanka?
Actually, there's a directorate for the elderly care. So there are programs going on in a administrative level to streamline the programs going on, and there are some programs they are preparing for some curriculum. They should conduct some national steering committee and some technical advisory committee, the partnership with the NCD also. So they have hand in hand, they do some work. There's no uniform disseminated program is going on for the elders. There's no program for the community-based level. At the moment, there's a JICA projects going on. They have selected 4 areas. They have a center for the elders who comes in the morning and they spend their life whole day at that place. They share their work and their ideas and things. Sometimes there are some programs going on to earn some money for them also. So like that, they are helping the people to do some work, and with the AGA office staff, they try to get some money. But it's still a pilot project. So those are the problems with the elders at the moment. Ministry have to disseminate those things and get it arranged. And there's another directorate for the non-communicable diseases, HLC program. There's a monitoring is there, the daily, they evaluate everything annually. So their program is going on. The female participation, it's good, but the male participation is very less. They said that is the problem, how to get this male. If you can give a bottle of arak, they definitely will come. So that's the problem. The HLC clinics, you can't cover everything. They screen the basic screen for the breast and cervical cancers, and then they screen for the diabetes, hypertension, and ischemic heart disease, and the obesity. The dementia, as she said, there are so many repercussions coming with the dementia in future. The osteoporosis is another big problem. There are so many issues with the psychological issues. So those things have not addressed yet in those clinics. For the females, we can some these middle life clinics in the hospitals. Normally we plan to do it on base hospital upwards. So there are consultants for the different disabilities. We can refer them to the specialized place according to that. Our grandmother and grandfather is looking after by the grandchildren and children. Now they are alone. So we have to see how we are going to look after these aged people. So we have to have a good plan and do something very quickly.
Okay, thank you for that very extensive answer. And moving on to our third speaker, you have a very lengthy question. And what policies and programs have governments implemented to address these issues?
First, as I menopause, it's not a one blanket all. Symptoms appear differently, and the impact those symptoms have on them also differ. Their health status, their support system, and their social cycles, and also their economic muscle, and again their educational level. This is not just the school books and all that, it's health education. Are they efficient enough in themselves to manage these symptoms? Because again, you see, menopause is a process. How you go through it depends on those. If you have those factors that I have mentioned, there are other things that also affect. Look at the culture of this person. Some communities do not talk about menopause. I would ask, do you have a name for menopause in your local language? Do we have that? From where I've come from, we don't have that. That comes with, it's you as a woman being condemned that you are old. And then you see some cultural practices put limitations on old people. Other cultures limit you from eating certain foods because you are an old woman. And because of the shame that comes with this menopause, we are not accepting it as a physiological process. This is not about them being old sexually. It is just the conclusion of the reproductive process. Their sexual health still continues. The sexual life should continue, but you have been condemned. And also it comes with health issues. Because there's drop in estrogen, the body feels frustrated, it becomes weakened, and so you find that you're becoming sicker and, like, in quotes, more sick. Because of the sickness, you need more medical attention. What does that mean? Using more money. Remember, globally, I have not seen a government that has given hormonal replacement therapy for free. And then when you also look at the same community, still, as much as they're condemning you to be old, still expect a certain, giving back to them. So there is that community burden being still placed on you. There's a change in pattern of abuse, elderly, or the women who are beyond their reproductive ages. And we are seeing there is a rise in abuse of women who are beyond their reproductive age, and it's a concern. And because of the weakened stem, we find they are also more susceptible to STIs. And remember, at this age, yes, it's also the other times when we are seeing long-term illnesses coming up, even some cancers becoming more prominent. If you are not well prepared, and the healthcare system is also not well prepared, you suffer more. These problems are more pronounced in third world countries compared to first world countries, because they are prepared and their people are informed and they have access to this. The second one, the policies, programs implemented by governments. We are seeing now the governments are trying. I'm being very intentional with trying because I'm not feeling the commitment from governments. Now the government is seeing the impact of this on the economy. So now the government are trying to see how then can we improve this so that we don't spend more on the healthcare of these people. And also the other policies that are now out and being campaigned is the workplace policies, especially in the private companies. There's a lot of campaign on menopausal leave. You are allowed to take leave, or you are allowed to work short hours, or you are given lighter duties. And then the other thing is also there's a lot of now public awareness. Most apps are in English. How many people at that age can read English? That is also a challenge, but at least the information is there. And then access to care, whether it is online or physical, it is improving. I'm happy that in Sri Lanka, at least there is a department that is talking about menopause. More countries say we have access to care only if the woman is able to know that this is what my problem is and can I have. But again, access to care that is not free. Any hormonal treatment is considered luxury in humanitarian situations. So you can imagine. Thank you.
Thank you for all those points. This is to Dr. Darshana Begunawardena. What policies and programs should be incorporated into a country's health system to address menopause-related issues more effectively?
We should find out these issues, and then we should find the options, how to mitigate and all these issues. The awareness is the main problem. So we should have a program to make everybody aware of this. Short-term plans is we should educate our service providers. And the other thing is, in the long run, I think we need to include this menopause module into undergraduates, postgraduates, and then midwife and the nurses at their levels. We should have a sort of a policy. We need a big backup from the ministry. So then we can, according to this policy, we can do something. And the other thing is, I think it is probably good if we can have a separate directorate. And the other thing is, now we have very less number of studies and research on this topic. So we should promote. Actually, so our founder president wants to, promote this research activities on this. I think he gave the 200,000 rupees to the society. That is only to support anybody who is doing research on this topic. And the other thing is we should have a dedicated clinic. So that would be very helpful for us to address this crowd. And then the access, and everybody should have the access to healthcare facilities. And the other thing is social stigma, and the other thing is the support groups. And I think this is very helpful. And the other thing is, all in all, we should provide them with menopause hormone therapy. At least if government can't give it free of charge, at least at a low cost. These are some of the initiatives I think which I plan, and then we as a menopause society. And the other thing is we should use the media. So we use this media in a professional way, in a good way, to get this crowd and then to educate them. And I think this is the need in the country now. I mean, even we know this is our goal, SDG goal. It says everybody should get the equal right for medical, the access. Government is going to invest in this because we can reduce this lot of health implications in this crowd, and then we can get them into the productive life, and so then will be the development of the country. We can make a resilient, the sort of environment to fight these health issues, and we can make a good future because these women again our future. Thank you.
Okay, Dr. So moving on to our Dr. Disanaika again, how are we going to educate the society and family to embrace menopause in a positive manner?
Actually, the menopause is a blessing. Menopause will start around, so she'll be 1/3 of her life is on this age. She's already menopaused and she's not bleeding. She whatever the thing she can wear, and there's no contraception to be used now. Again, she's now mature, so she can take good decisions, not like earlier. Most of the time, the family is completed, so she have more freedom. So she had earned something, and otherwise she know how to earn. So she have some money, so she enjoy menopause life in a good way. If she cope up with these symptoms and signs of the menopause, she have to do lot of things, as well as her family members have help her to enjoy herself and the society also. For that, I think the best person is public health midwife, and she can discuss these issues with herself and with the family members also. Population is very high, getting high for that midwife. Then we have to think about that, how you are going to minimize the workload of the PHM. The one thing is educating the school children. I want to tell about sensitization of the children also. We need, that's a big theme. Then the message is going with them to the house, and they know how to care their mother and the grandmother. The other thing is, one that we can do lot of things. Do some awareness program in the work environment sector. So at the moment also, Menopause Society is doing that. There are some leading companies are with us, join with us and getting that knowledge. And sometimes there are workers who are suffering with these issues, and because of that, they are getting, their work is less and they are getting blamed. So if the administrative level are sensitized on that, these people will come out with their problems. That's another thing that we can do. When you continuously get in leave, or then we can analyze these things, why she is get this leave. So we have to think those things, and in the workplaces we have to analyze all these things and correct there itself. I think the workforce will come, the work outcome will come better. Again, what I thought is the media already National told, but the problem is in the media, the airtime and things very difficult to get it. Sometimes the national media levels you can get some support, or sometimes you can make a teledrama based on this type of a story, even a film. So that's the one thing. And the other thing is social media, I want to emphasize. So it helps to answer the questions for the people, the person who is suffering these things, as well as the society also. And one more thing I want to tell is the small group. It's a very good thing if you can make it. So with there, you can make some recreational things. They share their knowledge and the issues and exercises, all these things.
Thank you, Dr. Disanaika. And moving on to our last speaker, Ms. Mukoya, to speak on what are the key age-related issues on a global scale and how have governments responded to these issues?
Okay, thank you. Age-related issues, of course, we are demographic shift. There is a projection that in 2050 we will have a doubled number of persons under the age of 60. We are going to have the older population will be bigger. Health challenges are there. We are looking at chronic illnesses, and then of course the economic impact. The sicker generation you have, the more draining it has to the. And then also there are other things like social issues. And then there is the caregiving burden. The elder needs support. They might not be able to do simple things on their own. So that also means that the government has to chip in, or the family or the community has to chip in. Then what is the government doing? So one thing is, yes, the government has acted. That is the reality. The UN has taken lead by developing a guideline that is called the UN Decade of Healthy Aging. A roadmap advising governments on the simple steps that they can do to ensure that their aging population is healthy, productive, and still independent. Most governments all over the world, you can see they are touching on the pension because they want to reduce the burden on themselves. Or if you are employed and you earn below $200, that's fine, you don't have to pay. Now they are saying even if you have earn $50, you must pay, because they are realizing that, and they may not have the money to support that. And also there's a lot of social inclusion and age-friendly environment. We are now starting to talk about aging and not condemning. And the government is doing a lot of that. Doctors talked about, educating the community and telling them about these aging processes. They're also trying to do, researchers are there, and they're trying to come up with packages on SRH in a life cycle. And then, of course, public awareness, they have said that very well. Education, media is there. Artificial intelligence has come to make it easy for us. But how do we use it? How do we integrate solutions, age-related issues? People, we should also not forget people who have surgical menopause. It would be right that we force the health system, or we task the health team to support these people. So those are things that we can, borrow and see that, to make life easy for aging population. Thank you very much.